Hi guys, this is Aditya and I've got Ekansh and Anirudh with me again, and this is our next video in our series.
Today, we'll be talking about the structure of the training program in trauma and orthopedics in the UK. We'll be looking at what are the requirements to get into the training program here, how the training program is structured, and what are the requirements getting out.
Another thing that I need to mention here is that we've all done our MS back in India, and we've all done it from government colleges. We've had a very good experience back home, and I think that experience has helped us gain a lot of perspective and given us a different vision when you come to the UK, and it's really helped us a lot. And I'm going to leave the stage to Anirudh to talk about the training program in UK.
Yeah, thanks, Aditya. I agree completely with your views about our MS program in India. So I'll begin by talking about the basic outline of the training program here in the UK. So what trainees would go through here is 2 years of core surgical training, of which generally there would be around 18 months of orthopedics. After those 2 years of core surgical training, you then enter the actual orthopedic specialty training program, which is commonly referred to as the ST3 recruitment. And that goes on from ST3 on to ST8, at which point one takes the exit exam, which is the FRCS, and then goes on to become a consultant. And so that's the basic outline of the program: 2 years of core surgical training plus 6 years of specialty orthopedic training.
Mhm.
As you can see, it's actually quite a long and grueling process, about 8 years of training within the field of orthopedics. And generally, you're expected to come out at the other end and probably do a year or two of fellowships before you can actually get into your subspecialty of choice within orthopedics. When you compare that to being in India, it's 3 years of absolute uh, grueling hard work, and you come out on the other side. Uh, a slight difference here being that, as you said, that you have to have a certain amount of basic orthopedic experience of having done about 12, DHS or hip fracture surgeries. By the time you actually get into training, you've actually acquired a reasonable sense of what orthopedic surgeries are like. You've understood what principles you use. And when you compare this to how the training is structured in India, by when you actually enter your PG, you can often be very undercooked because the surgical training exposure during internship is very, very patchy.
Yes, I think you're absolutely right. 3 years of India, you start from the beginning, and it's a very, very condensed 3 year and rigorous experience whenever you do your MS. But coming back to the UK, I think during your MS, a thing about the UK is that the number of surgeries you have to do are standardized no matter where you are, which is again in contrast to what it is in India, where there's a lot of variation. But over here, there's 1,800 surgeries that you have to do as an orthopedic trainee, out of which 1,260 have to be as the first surgeon. And they must have 80 arthroplasty surgeries of any joint and 80 arthroscopies. Um, and, uh, and unless and until you have that number, you're not allowed to sit the FRCS exam.
That's actually a very high number because if you think, yes, you do have 6 years to notch up those 1,800 surgeries, but for that you need to be doing at an average 300 a year.
Well, yeah.
Right. So the other, talking about the UK training program further, so you generally have a rotation through all major subspecialties in the UK. So generally, what the program would be like would be you would have ST3 year, which is your first year, would generally be dedicated to trauma. Then your ST4 year would generally be the year where you gain experience in arthroplasty. The subsequent years would be at least 6 months in pediatrics, 6 months in spine, and then in your later years of training in ST7 and 8, you would generally choose a subspecialty that you would probably want to do a fellowship in after completion of your training.
Yeah,
Mhm.
I mean, I think what this ensures is you've had a reasonable amount of exposure to everything, every subspecialty of orthopedics, like hands, shoulders, arthroplasties, foot and ankle, spine, pediatrics, limb reconstruction. So you actually gain a very, very wide and diversified perspective, and then you can probably take a reasoned choice of what subspecialty you'd like to specialize in.
Absolutely. Also, throughout the training, every year you have an ARCP process, which is essentially an evaluation of what you've done over the year, and you need to pass that evaluation to move on to the next year. Other than that, I think an important part of the training in the UK is research and publications and presentations, which is deep rooted into the training program, and it has to be documented. Everything has to be documented, which is the only thing that's actually going to take you through to the other side.
While this documentation can actually be annoying, but this stress on having to notch up quality improvement projects or audits or research makes sure that you come to terms with understanding what evidence-based medicine is. You understand what standards are actually followed across the world, what the current guidelines are, and that actually shapes your practice, I think. What do you think, Anirudh?
Yes, absolutely. And the documentation is quite rigorous, like you said, and trainees here have to maintain what is called an ISCP portfolio, which would generally include, evidence of your having discussed cases with your consultant marking you on the procedures that you've done, um, and then gaining what is known as a level 3 or level 4 sort of competence in certain specified areas. For example, knowledge about supracondylar fractures, for instance, say compartment syndrome, and other such sort of important orthopedic topics.
Yeah, I think
Um,
they're also known as critical case-based discussions, and stuff like compartment syndrome, necrotizing fasciitis, open fractures. These are stuff that everyone, each and every one, has to be absolutely adept at by the time they're getting out of training.
exactly.
Uh,
So your consultant has to mark you off as being, um, has to document as you being competent to that level in managing all of these conditions.
Another important thing I would believe about the portfolios is the focus on reflective practice and training. Uh, every surgery that you do, it's important that you document a reflection as to what you've done well, what you could have done better, and what you've learned from your mistakes or your surgery, or what if you've done something well, and how you would inculcate it into your practice into the next case every time. And this is something that's going to go on until the end of your career as an orthopedic surgeon, not just till the end of your training.
Absolutely. And I think one more thing that I've also felt, which has been very revealing, has been there's a push to actually train. There's also accountability on the side of the trainer to ensure that his trainees are being adequately trained, and their training is looked after in the terms of their knowledge, in the terms of their clinical skills, in the terms of their operative skills. And this ensures that the trainers actually take an active interest and make sure that there's actually documented progress and growth in the time that the trainees spend with them.
Yes, and even for logbook documentation, I think there are very clear definitions of how you've performed the procedure. So when you document in your logbook, you have to say either assisted, or there is something called STS, which means the procedure was done by you, but your trainer was scrubbed during the procedure, guiding you through the procedure. And then there's something known as STU, which is uh, supervised, but your trainer was unscrubbed. So I think there is, it gives a very clear sort of indication of what competence level one has reached with a particular surgery.
Uh, Absolutely. So moving on, I think essentially, once you've got those numbers in right, you can see that this is a training program which is going to last for 6 years once you've entered it. And every year, once you cross the hurdle of the minimum number of surgeries and reflective practices, at the end of 6 years, your consultants will sign you off for the national exit exam, which is the same for every trainee in the country, which is the FRCS. And as soon as you've done your FRCS, then you can apply. You get a certificate of completion of training, which is known as a CCT, which will allow you to apply for fellowships and consultant jobs.
So just to clarify that, an FRCS is actually a requisite for you to complete your training. It's not an option. It is akin to us giving the MS exit exams when we do our training. This FRCS exam is actually can be taken as per your comfort level. It's not held at a particular date. You can probably do it once you've had at least 6 years of training within orthopedics, that is ST6 and beyond, and consists of two parts, the part A and the part B. Part A being uh, MCQ based, EMQ based, and the part B being actual case based examinations.
Absolutely.
Right. So talking about once you've finished the training program, what generally happens is that once you've finished your FRCS, you are eligible for the CCT, which is a certificate of completion of training, and then you get on to the GMC's specialty registrar, and then you are registered as an orthopedic surgeon. Before applying for a consultant job, most people after doing their FRCS would do at least one fellowship. So if we look at how fellowships are done here in the UK, fellows are generally people who've had about 7 or 8 years or even more of orthopedic experience, uh, and who then go on to become a consultant in their chosen subspecialty.
Perfect. I think that's the entire orthopedic pathway in the UK. What we are now going to try and doing, we're going to conduct a survey. We're trying to do that, and just to see what the training experiences in India have been throughout different private and government colleges, whether it's an MS or a DNB. I think Anirudh, do you want to talk more about that?
Yes, so we've basically made a survey. The idea behind it is that what all three of us have found in the UK is that the perspective of the trainees is taken very seriously in the UK, and their opinion and their voice is quite strong here in the UK, and it really matters what a trainee thinks about the training that they are receiving. When all three of us looked back, we thought that maybe in India we didn't have so much of a voice as a postgraduate resident, and there is no collective sort of experience of the training in India. So we've just formed a survey which has questions about the MS experience, everything ranging from education to surgical opportunities to what your work was like and what your aspirations might be after doing your MS from India. The link for the survey will be with this video, and all three of us will be very grateful if you could fill this survey out and also send it to your orthopedic friends and other residents.
We certainly hope that this video, like the others, helps you understand uh, things better. Again, our motivation to doing this comes from the fact that uh, this is the kind of information we didn't have. And I think our motto is right information at the right time. And, you know, leave your any questions, any queries, anything you want to know, leave it behind on the comment section. We'll try our best to get back to you as soon as possible. If you take out a little bit of time to fill out the survey, it'll be really nice for us to actually understand and compare what others' experiences are. Once we actually have a substantial number of responses, we would actually share it so for everyone to see and understand and compare to as well. Uh, yeah, I guess
Yep.
that's it for this video.
Just to end off, I think we also have a mentorship program. If you have any questions, if you're interested in that, you can go to the link that we'll provide below. And our email ID is yourmentor121 at gmail.com. Okay.
Absolutely. And you can also find us on Facebook now. So find our Facebook page and hit the like, subscribe, and ask away. All right.
Okay.
Good night.